Hello, hello. It's Mr. Dwyer again. Welcome to part two of the notes for today. We're just going to do this online. Decided I'd bore you from home today. So I'm going to hit on the biomedical therapies on here. Just so you know, I did skip probably about 6 or 7 slides, so you're responsible for those. You can obviously get them off a Blackboard, and it'd be a good idea to also read the book along with this chapter. So I'm going to start off with one of the drugs that led to that process of deinstitutionalization that we talked about a few classes ago, called antipsychotics. So antipsychotics are primarily going to be used to treat, obviously, psychotic disorders. And the most common psychotic disorder is schizophrenia. Remember, what makes something psychotic is you literally break from reality, where you have hallucinations, things that are not there. You might hear them, you might see them, feel them on your arms, etc. A very disturbing process to both people around you and to the person suffering it. So antipsychotics are going to help alleviate those symptoms, both the positive and negative ones. You can see on the slide below the most common names of the drugs that are used as antipsychotics, also known as neuroleptics. And the drugs themselves act as antagonists to dopamine. So we know that dopamine is responsible for most psychotic breakdowns. It's tied to that selective attentionness within dopamine, where again, too much dopamine leads to the breakdown of selective attention, so it causes those hallucinations and potential delusions. So what these drugs do is just block that receptor, so dopamine can't cross the synapse, and it reduces delusions and other positive symptoms of schizophrenia. With this helpful part of the medication comes some troubling side effects. The most troubling side effect there is for taking antipsychotics is tardive dyskinesia. So tardive dyskinesia is this disturbance in your motor functions, where you almost have shaking, tremors, especially in the facial muscles. Also, antipsychotics can just generally slow you down, increase negative symptoms, make you feel lethargic, sexual dysfunctions, etc. The next thing you're going to see is a clip of a little girl experiencing tardive dyskinesia. So I'd like you to notice the tremors, the shaking within both her hands, her legs, and you can see some grimacing in the facial features. So here we go. Sorry for the second it's taken to get the video to load, but hopefully it's going to load in a second. So hopefully you can notice the motor disturbances, obviously, in the legs and in the arms. You can see your facial muscles, a little bit of grimacing, or especially in the mouth, it coming open a little bit. And this is a girl who was taking antipsychotics. So remember, antipsychotics can lead to this troubling side effect. So the next category of drugs we're going to talk about is anti-anxiety medications. And anti-anxiety medications are going to mostly be used to treat those disorders which have high levels of sympathetic response. So the drugs, or the disorders we should think of with that anti-anxiety drugs are going to treat are things like panic disorder, generalized anxiety, where you'd have those high heart rates, high breathing rates, all those things of an overactive sympathetic nervous system. And you can see the most common forms of anti-anxiety medications listed here. And the most popular form of anti-anxiety medication used today are called benzodiazepines. I know that's a big word to try to remember, but we are going to have to know that, especially like Xanax falls under that category. If you just want to remember it as benzos, that's fine. But basically what benzodiazepines do is it increases the level of GABA in a person's brain. So it's going to have a relaxing impact on someone. It's going to slow down their heart rate, slow down their breathing, often help people who suffer from insomnia, from anxiety, sleep better. And like all drugs, does have its side effects, where again, it does have a high risk of physical and psychological addiction. So people who are taking anti-anxiety medication usually have to be weaned off of the treatment. One of the most commonly prescribed medications is the category in antidepressants. And obviously antidepressants are mostly used to treat depression, since they're antidepressants, but they also do treat some anxiety disorders. So the most common anxiety disorder that would be treated by an antidepressant would be obsessive compulsive disorder. And again, you can see most commonly prescribed antidepressants listed right here. And basically, this is a little bit tricky. We're going to need to know specifically how antidepressants work. And the most commonly used antidepressants are in a category of drugs called selective serotonin reuptake inhibitors, also known as SSRIs. And I know that's like a really big funky word, but we're going to work through it and understand what that means. So obviously I think there's only one word that we really don't understand, and that's reuptake. You know what selective means, you know what serotonin means, it's that neurotransmitter that deals with mood, and you know what inhibit means. It means to stop or prevent something. So what a selective serotonin reuptake inhibitor is going to do is stop the process of reuptake. So I'm going to show you a picture of a neuron so you can see how this works. So right here we have the terminal buttons of ascending axon, right? And then right here would be the dendrite, and the terminal buttons are going to release the neurotransmitters, which is going to bind to the dendrites of the receiving neuron. And basically after a neuron communicates with another neuron, there's always a little bit of neurotransmitters left in the synapse. So what happens is this neuron goes through this process of reuptake, which just means that it reabsorbs the extra neurotransmitters back into the nerve ending. So this would normally processed be sucked right back up into the neuron. So what an SSRI does is it prevents reuptake from occurring. So when you take that drug, you can see right here, it blocks the process of it being able to be reabsorbed. And again, if it blocks it, that means the extra serotonin that was sent originally is going to stay in the synapse, thus increasing the overall level of serotonin in the brain, which will boost mood associated with helping to alleviate depression. The mood stabilizer that deals with the opposite spectrum of mood, mania, is lithium carbonate. And this is a common salt that was used that helps with the manic phases of that mood disorder. So you can see it's going to treat the high energy part of that. It's going to decrease norepinephrine. It usually does have some increasing serotonin effects, and again, like many medications, does have side effects, capable of overdosing, and it has some of the same side effects as antipsychotics. So the last drug that we're going to talk about is the drugs that are used to treat ADHD. So ADHD is attention deficit hyperactivity disorder. So these are the kids in elementary school that are bouncing off the walls, hard to pay attention. And remember, the thing with ADHD is not that they can't pay attention, it's that they pay attention too much. So every little thing in the environment distracts them. They're really easily distracted. They like to walk around the class a lot of times. So it's really hard to pay attention. And their brains are just wired a little bit differently. And for some reason, which still isn't exactly known scientifically, we do know that giving ADHD sufferers a stimulant like Adderall actually helps focus them. So for most people, a stimulant would not have a focusing effect, but with people with ADHD, it helps someone focus. So Adderall is a stimulant. So I know that's kind of counterintuitive, but we need to know that ADHD is treated with stimulants. So we're moving away from medication and into electroconvulsive therapy, also known as ECT. And remember, ECT is still commonly used. I know you get a lot of bad connotations from ECT, but it's still commonly used, and they'll use techniques now that aren't painful to the patient. The patient's not awake while they're receiving it, so it's not near as traumatic as it seems like on films and things. And the most common use of electroconvulsive therapy is for severely depressed patient, and usually they use it if no other method has worked. So if psychotherapy hasn't worked and medication hasn't worked, ECT is often used as a last resort, and the success rate is actually very high for people who have undergone ECT. Very limited relapse back in depression. The only negative side is some impact on cognition, and it's specifically memory deficits. We started watching that video last time called The Lobotomist. So psychosurgery is the most drastic intervention, which is obviously psychosurgery is going to be talking about removing specific parts of the brain or brain fibers to try to change behavior. So lobotomies were done specifically on violent patients, often psychotic patients, where they didn't know what to do with them. They were a danger to themselves or a danger to others. So the lobotomy basically attempted to quote-unquote cure them by going through the eye. It was called a transorbital lobotomy, and disconnecting the neural fibers in the frontal lobe. And that did have some unintended side effects where the person often had personality changes, but it did often calm violent patients down. The last people that we're going to talk about are just known as community psychologists. So community psychologists are kind of like community activists, and they kind of argue, why do we spend all of our effort just treating the disorder after it's already happened? Couldn't we do something to prevent disorders from happening? And that's why they look at things like unemployment, poverty, discrimination. They say in the areas that we study, all the areas that have the highest levels of unemployment, poverty, discrimination, those are also the areas of highest mental illness levels. So rather than just waiting for mental illness to happen, why don't we actively try to get rid of unemployment, poverty, and discrimination, change these things associated with poverty, and we can prevent mental illness from ever happening. So basically, community psychologists want to go out into the world, change society, in hopes that by being proactive, we can stop mental illness from occurring. All right, that is the end.